The breaking news, stay at home. That is the order tonight from 4 state governors as the coronavirus pandemic spreads. New York, California, Illinois, and Connecticut all ordering non-essential employees to stay home. Those orders cover 75 million people across the United States. New York's governor today telling non-essential businesses in his state to reduce their workforce to 0.
These are not helpful hints. This is not if you really want to be a great citizen. These are legal provisions. They will be enforced. There will be a civil fine and mandatory closure for any business that is not in compliance. Again, your actions can affect my health. That's where we are.
But President Trump saying these orders will not go national.
Given what Governor Cuomo has done in New York, is there any more consideration to a national lockdown to keep people in their homes?
I don't think so. Essentially, you've done that in California. You've done that in New York. Those are really 2 hotbeds. Those are probably the 2 hottest of them all in terms of hotspots. I don't think so, because you go out to the Midwest, you go out to other locations, and they're watching it on television, but they don't have the same problems.
The president, though, today did announce that he's closing the border with Mexico to all non-essential activity after already announcing the border with Canada will close. And the number of coronavirus cases jumped by nearly 5,000 here in the United States over the past 24 hours as testing has expanded. There are now 18,083 people who have been infected. 236 have died. One of them, we are learning in terms of infections, is someone who works in Vice President Pence's office. And we're going to have much more on that in a moment as we're just getting details on that this moment. I first want to go to Nick Watt. He's out front in Los Angeles. So, Nick, how are people there coping with these new ground rules, transformational ones?
Well, I've got to say, Erin, it's strange. Most of us have been living under this kind of stay-at-home thing all week. The schools have been closed. But I must say, now that there is an order out there, now that we're being told to do it, it does feel different, more restricting. And I just want to give you a quick view from a drone we have flying above here. That is the 101 freeway in Los Angeles, which normally at this time of day is a parking lot. Not today.
This is the day everything changed.
Californians, New Yorkers, the populations of Illinois and Connecticut will all soon be under orders to stay home. That's more than 70 million Americans.
To avoid the loss of potentially tens of thousands of lives, we must enact an immediate stay-at-home order for the state of Illinois.
These provisions will be enforced. This is the most drastic action we can take.
People can go to the store, get out for some solitary exercise, but stop socializing.
We're going to go visit Mom. I'm going to bring the home family to see Mom. No, not now.
Essential workers are exempt, like food service and healthcare providers who are still struggling nationwide to find the supplies to keep themselves safe and treat the sick.
We're starting to see those individuals become sick as well and be taken out of the workforce, or in some cases become seriously ill. So here's where everything can fall apart very quickly.
In Los Angeles, they're erecting tents in hospital parking lots to treat coronavirus patients. Midnight tonight, the Mexican border will join our northern border and also close to all but essential travel. The undocumented will not be allowed to cross.
We're not sending them to Mexico. We're sending them back to their own countries.
Goldman Sachs now estimates that this week, 2.25 million Americans filed for their first week of unemployment. If that estimate is accurate, it would be 8 times last week's figure and an all-time record. All interest on federal student loans now suspended. Tax deadline day pushed 3 months to July 15th.
This is not a permanent state. This is a moment in time.
How long it lasts, we don't know. The mayor here in LA says a month. He thinks could be 2. And we just heard from the mayor of New Orleans. They are implementing a similar stay-at-home order. When New Orleans stops partying, Erin, we know we got problems.
Nick, thank you. And I want to go to Caitlin right now. Caitlin Collins out front at the White House. And Caitlin, the breaking news there, someone in the vice president's office has tested positive. Obviously something, everybody needs to pay attention to, be concerned about. But what can you tell us?
Yeah, this is really the closest we've seen it come to the West Wing. It's now, we are being told that the vice president's office was informed tonight that someone in the vice president's office has now tested positive for coronavirus. They don't identify who the individual is, though. They said they had no contact with the vice president or the president in recent days, but they say they are following those CDC guidelines, Aaron, to figure out their tracing, who it is that they did have contact with, and if that person potentially came in contact with the president, the vice president, or any other of the senior staff here. Though we should note that most of the vice president's staff is in the EAOB. That's this building right next door to the West Wing. It's a separate building. You've got to walk across the street essentially to get in there. And so it's not likely it was someone who was walking around the West Wing a lot, though we don't know that for certain. So we're trying to figure that out. And of course, Aaron, we should point out this comes on the same day that the president's daughter and senior advisor Ivanka Trump returned back to the White House after now we are being informed she did take a test for coronavirus. She got results today that they said were negative, and that comes after she had herself spent several days working from home after she came in contact with a senior Australian official who had later tested positive for coronavirus. So really what this shows you, Aaron, is as we're reporting on this, you see what Nick is talking about around the country, we're seeing how close to home it's hitting even for those people who were working inside the White House.
All right, Caitlin, thank you very much. And I want to go now to Dr. William Schaffner. He's professor of infectious diseases at Vanderbilt University Medical Center, also a former CDC official. Dr. Schaffner, I appreciate your time. So let's just start with this news that Caitlin's talking about from the vice president's office. A staffer there has tested positive. So, now what does this change? I mean, does this mean, for example, that the president and the vice president should not be together from this point on?
Well, it certainly looks that way, Erin. You wouldn't want the president exposed. You wouldn't want the vice president exposed any more than he is already. And I think they ought to institute 6 feet plus to keep apart, yes.
And I mean, I'm sure on some level this doesn't surprise you, as we know this is much more widespread than any testing would indicate because there hadn't been testing. But what is the significance of this, that you now have this actually in the vice president's office where there are, the meetings of this team, they stand together side by side on that little platform every day doing their presentation? As we see here, I'm showing video, including Dr. Fauci, who's in charge of infectious diseases.
Thank you very much.
Well, we always thought that was a bit of a crowd, and now the virus is right there. And if there were unbelievers in the country, they must be convinced by now.
So now we have the stay-at-home order, which affects Americans across this country. New York, California, Connecticut, Illinois, all under some form of a stay-at-home. Governors are telling non-essential workers to stay home and saying this isn't a choice, this isn't what you've basically been doing, this is now the law. How long do you think this would need to last to be effective?
It's getting seriouser and seriouser. A matter of weeks for sure, but I can't predict how long. But I would hope that in several weeks we could start scaling back step by step.
And that's because you think by that point we will have seen this big surge they're anticipating, how big it is, what really presents at our hospitals.
Yes, that's exactly right. And I would hope we could dampen that surge, spread out that curve as we have been talking about, and see what's happening. That may not be enough. We may have to extend at least some of these restrictions even longer.
What about a national lockdown? President Trump says that is not necessary. He references the Midwest, many places where you have seen fewer of these cases. Is he right about that or not?
Well, traditionally, public health has been the responsibility of each individual state. So I think each state is going to decide that. I know that our governor has received some petitions from many colleagues that we ought to consider doing that here in Tennessee also.